We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
Hi, my name is Ellen Patton. I know several people in here, and I do know that people know my story, but there are some new people here that I'd like to share it with. At the age of 40, I had countless years of a bad marriage and had decided to make major changes in my life. I was looking forward to that second chance to have a happy life. Mesothelioma stole that second chance. On June 1st, 2001, at the age of 41, I was blindsided by the diagnosis of malignant pleural mesothelioma. I was told to prepare to die. I unknowingly was exposed to the silent killer at some point in my life. I never worked with asbestos. I do know that my father's home improvement projects around the house could have been my exposure. However, I could have also been exposed through relatives, occupational exposure, or through consumer products. Like many other mesothelioma patients, I was initially misdiagnosed. Even after receiving the proper diagnosis, things didn't get any better. My oncologist told me things like, "You can fight it, but we've never known anyone to beat it, and enjoy the little time that you have left." The median life expectancy for a patient diagnosed with mesothelioma is 6 to 18 months. Here I stand 14 years later. Thank you. As an outlier, however, there are so many people that are living and outliving the initial diagnosis. Some may say that I'm lucky. However, these last 14 years have been some of the hardest years of my life. Sorry. Which one? Oh, okay. Thank you. I don't know how I was exposed to the asbestos. What I do know is that I was left with a horrendous disease that invaded both of my lungs, and minimal treatment was available. Surgery would have been too invasive, and the side effects of chemotherapy were killing me. I decided to opt for an immune therapy, an alternative therapy in the Bahamas. 3 times a year, every day for 2 weeks, I would go for the alternative treatment. This posed a financial burden of $21,000 a year, and I wasn't even sure that it was going to help. However, when you're told you have no options, you accept any little chance. Unfortunately, being diagnosed with mesothelioma, I'm uninsurable, making it even more challenging to fight this battle. I can't work because then I'm not eligible for Medicare. I have to be choosy about what I go to the doctors for. I even have to go without my pain medication. Asbestos has brought this never-ending cycle. As I just said, I ended up receiving the immune therapy. I tried to get help through conventional medicine. In my search for the help, I sought out treatment at Johns Hopkins, Brigham and Women's, University of Chicago, and University of Maryland. Because my disease was bilateral, I was not eligible for surgery, as I said. However, I am followed by a wonderful doctor at University of Maryland, Dr. Peter Hausner. Whenever he sees me, he always smiles and reminds me that my longevity is a miracle and to use my time well. Not having too much luck with this. Recently, I attended a conference or a briefing in DC with Linda on the FACT Act. I spoke to them about the concerns that I had, and one issue was that the FACT Act would have robbed my safety. In fact, a situation that I had, an example was a known criminal and a convicted arsonist received my information that I had made public concerning my diagnosis and used it to scam other cancer patients. He used my photo and my testimonial for the Alternative Treatment Center and used it to promote a fake cancer drug. While trying to get my name, photo, and stolen testimonial off of his website, I was harassed and threatened. He also falsified FDA forms, which turned into a federal case. I then received a federal subpoena to testify against this known criminal. Needless to say, I was terrified. This is just one example of how someone can prey on cancer patients when privacy information is publicized. Just like me, no one would be safe if that FACT Act was passed. When I was in the Bahamas, I met who turned out to be my best friend. She unfortunately passed away of mesothelioma. She died 5 years ago. At that time that Pennie died, I went out to be with her family and to be with Pennie. Her daughter, Kayla, her only daughter, Kayla, was given birth to Olivia on the 4th floor of the local hospital while Pennie lay dying on the 5th floor. I assisted Kayla with her birth, or with the birth of her child, while Pennie's husband, Rob, was at Pennie's bedside. I'll never forget the day or the night that she died, seeing her numbers decrease. And then when she took her last breath, the monitor went black and said, "Reset for next patient." I can't help but to wonder when I'm going to be that next patient. As my doctor requested me to use my time well, I find it's my responsibility to testify and to speak up for the ban of asbestos. Unfortunately, people are unaware that asbestos is even still available. So I'm trying to use my time well. Thank you.